Continuing to bring you all angles of mental health, and health experts are worried about the impact of the COVID-19 pandemic on mental health for all of us, especially though the youth, how different their world is over the last 18 months. The World Health Organization estimating that mental illness accounts for 16% of global disease and injury burden among very young kids, 10 to 19-year-olds even. Suicide is sadly reported to be the fourth leading cause of death among children between the ages of 15 and 19 years. Now, here's the problem. The outlook for South Africa's youth is also very, very grim. What a pleasure it is to welcome Body Mind Wellness Clinic CEO, Dr. Rita Sonko, who's joining us. Dr. Sonko, good to have you with us on ENCA. What a pleasure to speak to you. And I knew that mental health was a problem before COVID-19. We always spoke about it. But just how much worse has COVID-19 made it, especially for the youth?
Thank you. Thank you so much for having me. I think that COVID has made it so much worse because young people are quite isolated. They are not able to attend school. They are not able to attend church. They are not able to gather as they normally would. And that's been a big problem. So that isolation has particularly caused a lot of problems. And also, obviously, also disrupted the services that we would normally offer. So a whole lot of community-based services were quite disrupted during the lockdown season. And it's now much better. We're in level 1. So we really need to ramp up and provide those services to the young people.
I would have imagined after nearly 2 years of COVID-19, Dr. Sonko, that we would have found better ways of, or the experts would have found better ways of trying to help the youth that need to be isolated during school hours, etc. I mean, what suggestion would you put in place for someone watching now, perhaps a parent, a guardian, a teacher, to try and keep the kids engaged, especially during harder lockdown levels?
Yeah, that's a great question. I think there's a lot of challenges, and obviously during the pandemic, you know, the peak season of the pandemic, we are really as a health system overwhelmed by a number of things that are happening around us. But I think now it's time for us to really start using any resources available to us, your online tools that are available to us, health screening, digital health tools. This is very, very important that we can tap into all those resources that are available so that you're not relying necessarily on actually going into a clinic to get any help. There's a lot of online resources available and online tools that people are coming up with. And we're quite excited about our Mind Wisdom, which is a tool that we just developed with strategic analytics and management, which is really helping to do the screening remotely. And one can be at least able to understand what's going on with a child if they can answer a few questions and immediately get some information about what's going on with this child. It gives you a rating of whether the child is in the green, the yellow, the red, and you know what kind of actions to take. So I think schools, employers, clinics, we all need to just pay more attention to mental health and really do a lot more screening routinely. For mental health, which we don't usually do. When people come in, we kind of attend to everything else, and then mental health only comes up as a by the way. So we really need to be much more proactive with that. So a lot more screening, proactive screening, and case finding.
I'm interested to hear more about the online platform that you say was developed. I'll tell you why. Because I would have imagined that with the number of hours that kids and teenagers, doctors, spend on their electronic devices, whether it's a phone or whether it's an iPad or a laptop, that there would have been more tools available directly to them to try and talk about whether it's a depression or whether they're feeling isolated or whatever it might be. Is that where you're suggesting we need to get to? I understand you're saying we need to speak to parents, get stakeholders involved, etc. But are we able to talk directly with kids on the platforms that they spend so much time on?
Yeah, I think that's where we need to go, really. Utilize all the technology that is available and make tools available to young people to access. And I do understand a lot of the children that we've been working with in our research don't necessarily have access to these online tools. So there's a bit of a disparity there, and that's why the theme for this year's World Health Mental Health Day is very important, that we really need to look at equity in access to resources. And so while we talk about digital access, it's not all teenagers in South Africa that are able to actually access online tools. So that is something we're very mindful of. But those that are able to access, they should be given that access. And we should work with the schools and the clinics and the community programs to provide that access through various means to those that may not be as advantaged to have their own gadgets and access to data.
Dr. Sonko, before I let you go, let's just ask an obvious question for the parents and the caregivers. How can you start telling the difference between just a really grumpy 15, 16-year-old boy and girl who's just moody and your child who actually has a mental health problem? Because I don't find it would be very unusual to find a 15 or 16-year-old just holed up in their room all day on their computer. Where's the line? When does that start becoming a problem? Perhaps my last question to you.
It's a great question. I think the frequency of these experiences is very important. How often is the child feeling like this, moody, isolated, not wanting to participate in routine activities, not having friends, not wanting to go to school, for the little ones being very clingy, crying a lot. Even adults, let's face it, that adults are also going through a very tough time right now with a whole lot of job losses and all sorts of things. So we really need to be paying attention to what is seemingly normal and what doesn't seem normal. And if you have a bit of worry about this, absolutely seek help. Use all these resources we're talking about so that you get the child to actually do an assessment, a self-assessment. This is what we've created with the Mind Wisdom through our wellness clinic. To be able to self-assess, determine how this thing that I'm feeling, is it normal or is it seemingly, out of control right now? And I think for parents, it's really about linking children to those resources and getting them the help. And there's a lot of online support as well, free call centers that you can call in 24/7 to seek that help, to speak to an online counselor and basically just get some help. Yeah, so I would encourage parents not to ignore these kind of questions. Yeah.
It's all very important as well. If we've got all access to these resources, online resources, we're using it to do work and to entertain ourselves. Let's also try and fight and help mental health as well. Dr. Rita Sonko, what a pleasure it was to have you with us here on All Angles. I'm sure you want to get more information. You can just go look for Body Mind Wellness Clinic. I'm sure you can find a lot more information on that if perhaps you are concerned or you're just interested about what the warning signs could be. So